I'm Jonas Roach. I'm a third year BSc Sports Rehabilitation Strength Conditioning student with Plymouth University. So this video is about Pronation Distortion syndrome. So the first thing that we need to consider when having a look at this syndrome is actually identification of movement dysfunctions. Movement dysfunctions can lead to injuries throughout the body. So imagine the same as a building. If the support structure is weak, this can lead to imperfections biomechanically and later develop into injuries. Identifying movement dysfunctions in time can prevent these injuries. For the rest of this video, I will refer to Pronation Distortion syndrome as PDS. So what is PDS? PDS is essentially excessive foot pronation, so the same as being flat-footed, with knee internal rotation and adduction, which is essentially being knock-kneed. But the most commonly affected areas when suffering with PDS is pain located in the knees, hips, feet, but also this condition does affect the lower back as well. So PDS is caused when the foot is overpronated. This syndrome can be something you're born with, or you can develop over time due to bad posture and walking with a poor gait. So the next section of this video will be affected tissues and anatomy. PDS affects the tibia bone. This causes it to move inward and results in knee valgus. The patella is affected also, causing poor knee tracking. So this increases stress on the ACL, causing the femur to adduct towards the midline of the body. So vastus lateralis, biceps femoris, and the peroneal muscles tighten and shorten due to PDS. Lastly, the lower back suffers due to this condition. This is because the knock-kneed effect puts strain on the lumbar spine, causing anterior compression, and therefore the pelvis anterior rotates, compressing nerves and muscles in the surrounding area. Guidance, advice and treatments for PDS. To combat PDS, there are certain corrective exercises that can reduce the pain by strengthening the weakened surrounding areas. Exercises that strengthen the glutes, the calves, peroneals, hamstrings, abs and abductors, and also the intrinsic muscles of the feet. So here are some appropriate corrective exercises that would help reduce the pain caused by PDS. Section is about other measures that could be used to combat PDS and the pain that it could cause. Other measures are foam rolling. This measure relieves the tension and tightness in the muscles, gaining the sufferer to increase flexibility and mobility, which would prevent the injury from getting worse. And here are some foam rolling exercises that you could use. So, these corrective exercises work to alleviate PDS by means of restoring the body's strong foundation, like we mentioned in the beginning of this video. This happens when the surrounding musculature and other anatomical structures become strengthened by the corrective exercises. Also, the other measures such as foam rolling help to increase flexibility within the weak muscles associated with the syndrome. Carrying on from this then, regular corrective exercise drills such as the ones stated in this video could reduce pain dramatically over time and eventually full alleviation of someone who's suffering from PDS.